Welcome to our video on advanced teaching techniques for medical students. In the next 10 minutes, we will dive deep into transformative methods designed to elevate the quality of medical education. This video will explore innovative approaches, practical examples, and evidence-based strategies to help educators and students thrive. Advanced teaching techniques are not just about adopting new tools or methods. They enhance the student learning experience and build competent, compassionate medical professionals. We'll begin by outlining the common challenges in traditional teaching methods and how our advanced techniques offer tangible solutions. From interactive learning and simulation-based scenarios to the flipped classroom model and technology-enhanced education, you will discover multiple ways to engage students more effectively. Medical education is evolving, and staying ahead of the curve is crucial. These advanced techniques are integral in preparing future healthcare providers to meet complex patient needs. As we journey through this video, keep in mind the real-world impact these teaching strategies can have. Let's get started on this exciting path to transforming medical education. In the realm of medical education, traditional teaching methods are often the norm. However, these methods frequently fall short in engaging students and providing necessary practical knowledge. Lecture-based formats can leave students feeling disconnected and overwhelmed, struggling to bridge the gap between theory and real-world application. Educators face their own set of challenges. Large class sizes and time constraints make it difficult to offer personalized guidance or hands-on experiences. As a result, many students find themselves underprepared for clinical environments, where quick thinking and applied knowledge are crucial. But why do these methods persist? Partly because they are tried and tested, familiar to both teachers and students. Yet, the drawbacks are becoming increasingly evident in today's fast-paced medical landscape. We need to ask ourselves, are we truly preparing our future medical professionals for the demands of the profession? It's essential to explore and implement advanced teaching techniques that address these limitations. In the next segment, we'll dive into one effective solution: interactive learning. Stay tuned to learn how this approach can transform the learning experience and better prepare our students for their future careers. Having identified the common challenges of traditional teaching methods, we now introduce a powerful solution: interactive learning techniques. Interactive learning transforms the educational experience by making students active participants in their own learning journey. Rather than passively absorbing information, students engage in group discussions, collaborative projects, and hands-on activities, leading to deeper understanding and retention of knowledge. Consider the impact of group discussions. When students debate and defend their viewpoints, they grasp complex concepts while developing critical thinking and communication skills essential for medical practice. Additionally, hands-on activities provide practical experience that is invaluable in medical education. For instance, practicing clinical procedures on simulators bridges the gap between theory and real-world application, ensuring students are well prepared for their future roles. Interactive learning techniques also foster a more inclusive and dynamic classroom environment. Students are more likely to contribute and share ideas when they feel engaged, leading to innovative solutions and a richer educational experience for everyone involved. We will delve into specific examples of these techniques in action, starting with our next segment on simulation-based learning. Stay tuned to see how these advanced methods can enhance your teaching and benefit your students. In the world of medical education, one of the most powerful tools we have is simulation-based learning. This approach allows students to practice complex medical procedures in a controlled and safe environment, significantly enhancing their practical skills and confidence. Imagine a scenario where a medical student, not yet licensed to perform on real patients, can practice life-saving techniques on advanced simulators. These simulations replicate real-world scenarios, complete with patient responses and critical decision-making moments. For instance, students often use high-fidelity mannequins to simulate emergency situations. They can hone their abilities to diagnose and treat patients, all while receiving real-time feedback on their performance. The benefits are immense. Not only do students become more adept and prepared, but they also experience reduced anxiety when faced with actual clinical environments. Simulation-based learning bridges the gap between theoretical knowledge and practical application, crucial for developing medical professionals. Next, you'll see another advanced teaching technique that's revolutionizing medical education, ensuring students are more engaged and better prepared for their roles. In today's segment, we're diving into the flipped classroom model, a transformative approach reshaping how medical education is delivered. This model turns traditional teaching on its head by having students engage with theoretical concepts at home, often through video lectures or readings, and then applying what they've learned through practical activities in class. The flipped classroom offers numerous benefits. It allows for a more interactive and engaging classroom experience. Students arrive prepared to discuss, question, and practice, making the most of valuable in-class time. Implementing the flipped classroom in medical education can significantly enhance learning outcomes. Educators can focus on facilitating hands-on practice, clinical simulations, and problem-solving exercises, crucial for developing competent medical professionals. The autonomy to learn at one's own pace at home also caters to diverse learning styles, ensuring that each student grasps theoretical knowledge effectively before contextualizing and applying that knowledge. Next, you'll see how problem-based learning takes the principles of the flipped classroom further, empowering students to tackle real-world medical cases. Stay with us to explore this next level of innovative teaching. Let's dive into a powerful case study about problem-based learning, a teaching method that transforms theoretical knowledge into practical expertise. Problem-based learning encourages students to tackle real-world medical cases, promoting an active approach to education. This method builds critical thinking skills by challenging students to find solutions to complex problems they might encounter in their medical careers. In the context of medical education, this technique is particularly beneficial. By working on actual medical scenarios, students are not just passive recipients of information, they become active problem solvers. They must collaborate, hypothesize, and apply their knowledge in practical situations. This hands-on experience is invaluable in preparing them for the realities of the medical field. Problem-based learning fosters not only individual critical thinking, but also teamwork and communication. Students must articulate their thought processes, share insights, and debate different approaches, essential skills in any healthcare setting. Next, we'll explore another advanced teaching method that leverages technology to enhance the learning experience. In the ever-evolving landscape of medical education, staying ahead means embracing technological advancements. Technology-enhanced learning is transforming how students grasp complex concepts and practice vital skills. Virtual reality immerses students in simulated clinical environments, allowing them to practice procedures without the risks of real-world application. Online platforms offer flexible, on-demand access to educational resources, ensuring learning is continuous and adaptable to individual needs. These tools not only make learning more engaging, but also provide practical, hands-on experiences often missing in traditional methods. Imagine rehearsing a surgical procedure countless times in a virtual setup until it becomes second nature. This is a reality made possible through technology. By integrating these advanced tools into the curriculum, educators can bridge the gap between theoretical knowledge and practical skills. You'll see how these innovative approaches are reshaping the future of medical education, making it more dynamic and effective. Stay tuned as we explore the next wave of groundbreaking techniques that empower educators and inspire students. In today's rapidly evolving medical field, collaborative and effective educational strategies are critical. Enter team-based learning, a technique that fosters teamwork, communication, and problem-solving among students. Rather than passively absorbing information, students engage actively, learning from each other and preparing for real-world medical practice. Consider a practical example in a medical setting, a group of students tackling a complex patient case together. Each member brings unique insights, while the group collectively navigates the diagnosis and treatment plan. This collaborative approach enhances learning and mirrors the multidisciplinary teamwork found in real medical environments. Promoting essential skills such as communication, critical thinking, and shared responsibility, team-based learning prepares students for the challenges they will face as healthcare professionals. We'll explore how integrating team-based learning can transform your educational practices and lead to more engaged, prepared, and competent medical graduates. Join us as we delve into the practicalities and transformative power of team-based learning in medical education. In the realm of medical education, assessment and feedback stand as pillars of student development. Effective assessment techniques allow educators to gauge student progress accurately, identifying strengths and areas for improvement. Feedback, when delivered constructively, guides students on their learning journey, motivating and directing them toward excellence. Advanced techniques, such as formative assessments and peer reviews, grant educators the tools to foster an environment of continuous growth. Utilizing data-driven insights, personalized feedback, and reflective practice, these techniques elevate the learning experience. We will uncover how these methods enhance academic performance and prepare students for real-world medical challenges. Stay tuned as the next segment unveils practical strategies to integrate these advanced techniques into your teaching arsenal. As we conclude, let's reflect on the journey we've embarked on together. We've explored a range of advanced teaching techniques designed to revolutionize medical education. From interactive learning and simulation-based practice to the flipped classroom model and problem-based learning, each method plays a critical role. These techniques not only address the shortcomings of traditional methods, but also significantly enhance student engagement and practical skills. Incorporating technology, such as virtual reality and online learning platforms, offers immersive, flexible, and dynamic ways to teach. Effective assessment and feedback techniques further ensure continuous improvement and success. By embracing these advanced approaches, educators can create a richer, more impactful learning environment, preparing students not just for exams, but for real-world medical practice. These methods empower students to think critically, collaborate effectively, and apply their knowledge in practical settings. I encourage you to start implementing these techniques today. See the difference they can make in your classroom and witness the transformation in your students. The future of medical education is in your hands. Take the first step now, and let's elevate medical teaching together.